Deputy Pauline Tully.
Well, good to hear that. Good morning, and you're very welcome into the committee. And I want to first of all commend you as a charity, because I know the absolute wonderful work you do for people with EB and their families. So it's tremendous. Just in relation to a follow-on from what Colin asked there about the bandage scheme, I mean, there have been requests. One of your asks is a national bandage scheme that's operated in other countries. I think, is it Australia have one and so on. Are we getting anywhere closer to seeing that being realised? Because I know from talking to people with EB before, sometimes the bandages they receive are not the right size, or they're not sufficient quantity, or they're late, coming to them or whatever, and it can cause severe problems if the correct bandages are not available, like there's a risk of infection. So is that being considered at the moment?
There's two issues there. There's one around the covering of the bandage financially, and then the whole process of issuing the bandages. So yes, you're correct. People with severe forms of EB, their bandages should be ready to collect at the public health centre monthly or whenever they collect them. And I don't think there's the awareness of the importance of the sizing. So they might get a size that's too small, who the suppliers might think is fine, but without understanding the condition, when in actual fact they can't use it. So they have to go back and look for more, which is a lot of pressure on parents who are already struggling trying to coordinate all of the care in the home, and then having to try and go back with issues with bandages as well. So it's about fixing the system, I suppose, and building awareness there, as well as making sure that there's a bandage scheme for all people with EB in Ireland. Australia have a fantastic scheme where the bandages are delivered to the house every month for all types of EB, doesn't matter how severe or how not severe it is. And also, I think Spain and the UK as well. The UK have one particular supplier through pharmacies, and again, once they have a note from their clinician explaining what bandage types they need, that's all organised for them, and they get that ongoing.
Types of EB as well.
Yeah, and all types of EB.
Okay,
so it'd be lovely to see something like that in Ireland as well.
EB is not included in the long-term illness.
No.
I don't understand why that is, but what benefits would that bring if it was included?
Yeah, so if it was included in the long-term illness, it would allow all families living with all types of EB to be able to access the medication and the dressings and the equipment that is specific to their type of EB.
Okay.
Right now, as Sinead and Rosemary have said, there's a whole cohort of people missing out. They either earned too much to get the medical card, or they're not. So they're falling between the cracks. Yeah. And the long-term illness would absolutely align with what we would think is the right direction for people living with EB.
And why is it not included? Because it's not curable. It's a long-term illness.
True. Yep.
I'm just wondering why. What's the reason given? What criteria does it not meet? Or
it's something that we have to consider. But I think there is this. I hate using the word mild, because there's nothing mild about EB, but because of the different severities, that causes complications. So it is something that we have to consider, and something that is on our agenda to bring forward to really advocate and lobby for that going forward.
I know in relation to carers, you identified that there are insufficient. We know there are insufficient carers in the community, but we really need to see specially trained carers, don't we, for people dealing with the EB again? Because I mean, if there's a changeover of carers at all, it means somebody starting from scratch, not knowing the extent of. So I mean, we hear from the department all the time that the money is available, but the carers just aren't. So I mean, what we really need, is there a possibility of looking at specially trained carers for people with EB?
I suppose that's the biggest challenge that parents and carers of EB have at the moment. It's huge stress. So the home care nursing is subcontracted to agency nursing, and there's a huge. I mean, it's not an easy job. Doing a 4-hour bandage change, inflicting pain on a child, it's horrendous. So it's a very niche area for a nurse to stay in, and there's a real struggle around that. And we've had much experience of nurses being trained, and it's specialist training that they need, and then moving on. So with the agency care, I think there's a lot of turnover. So we get a lot of nurses moving on. I think one parent was saying in the Avery room there last October that she had 39 nurses in 1 year. I think it could have even been one season. So there's a huge struggle here. I mean, we know that there's an issue with supply of nurses in general, but then when you ask them to go into this niche area, so this is something that we're really asking to really kind of implement a sustainable service where we can have a care coordinator who can coordinate all of these nurses so that the parents don't have the stress of having to do that and not have to worry about what nurse is going to cover next week when my nurse is on annual leave, or if a nurse moves on, we have to start this training all over again. And then having the outreach nurse in place as well for the adult services. We have a fantastic system in place for the youth services at the moment, so putting that into the adult service. So we have these nurses coming from the acute setting, coming into the community and actually training these nurses and giving them support as well, to help them kind of stay as well, and do something around the price point of nursing to make it more attractive for nurses to stay in this setting, because that's the biggest challenge at the moment for people with EB, I think.
I would agree with you, Sinead, that there's a real problem with retention as well as with recruitment. And from the retention point of view, the appointment, if we can get the monies for an adult outreach nurse, that they will support the nurses that are leaving now. So that I think that would make a big difference. All right. And there was something else I was going to say. Oh yeah, from the retention point of view, that they find the hours are difficult. The nurses, like they're approved for 3 to 4 hours 3 times a week, and most nurses want more time than that. So if we could try and find a solution for that would be great. But increased remuneration, because I think these are complex care nurses. They're very, it's a special niche, and they are very special people that will make a huge difference in people's lives. And so I think there probably are nurses out there who would like to take it on, but don't feel they have that flexibility to just take on the 3 hours, 3 days a week. I think remuneration would go increased remuneration would go a long way to help keep them.
Yeah, I know my time is up, so I'm conscious of that, but I just wanted to very quickly mention the economic burden on people with EB. It's massive. So I presume that includes having to purchase all the services. Yeah.
Bandages, hospital visits, everything. I mean, DEBRA do support them with grants as much as we can, but there's huge financial burden on top of it. If you have a new baby born with EB, you've lost a life you knew before. I mean, most of them are inherited recessively, so they've no idea before the child is born that they have EB. A parent usually has to give up their work, their life to care for this. So there's a loss of earnings from the parent having to give up work. There's no contribution from the child when they grow up. They won't work either. And then when you include hospital stays, bandaging costs, and costs for PAs, home nursing care, it all adds up.